Sarah, I want to warmly thank you for your presentation. We have received a number of questions that we probably won't get to all of them. Yep. However, I'm going to just start with some of them that have come in. Do you have resource suggestions for children beyond the heteronormative boy-girl body books?
I know there are quite a few out there. I would welcome that person to email me. I do know of some. So
one of the questions that came in was, could I have some clarification on one of the stats Sarah mentioned? It's 46% of all HIV positive youth are Aboriginal. Did I hear this correctly? And is this a national stat?
Yes, that was a national stat from 2009. I think it did go down slightly in the years since then. I wanted to use that number to show the great overrepresentation of Indigenous youth who are HIV positive.
Are there any words beyond at risk that are already being used which capture the ideas Indigenous youth have communicated and perhaps that they would prefer to be used?
So in terms of other words, I think that what we heard from in that research was that Indigenous youth just want to be called Indigenous youth. They don't want to be called at risk. It's understandable. There are certain kinds of frameworks that especially government funding comes out for at-risk youth. And so we might use those terms in, say, a funding application. But to put posters up or put out call for young people using at-risk can really be re-stigmatizing. So to instead just use Indigenous youth of a certain age or ways to simply talk about Indigenous youth in those terms, I think knowing that that's going to be more welcoming for a range of young people. There are certain times that at-risk is used to talk about, for example, street-involved youth or youth living in poverty. Again, I think there's ways that those youth can be targeted for programs, or those programs can be geared towards those youth by where you are letting youth know about the groups and that kind of thing, just posting them for Indigenous youth, for example, not using that term at risk necessarily. For myself, I try to talk about where the risk comes from, or where instead of talking about people as being inherently vulnerable, to talk about vulnerability being produced in particular ways for certain young people. So I think there's still a way to talk about the source of risk, the source of vulnerability, but not to see that source as originating with Indigenous people ourselves.
Okay. Have you come across any examples or case studies of health or wellness care provision or settings that do a good job of accounting for the unique needs of two-spirit individuals?
I haven't really, unfortunately. I do think that, thinking about in HIV/AIDS work, for example, just the integration of two-spirit people in all areas of that field. I think that service provision, healthcare, the way that sexual health is talked about, is one area in which there is just a more normalization of language around gender and sexuality, two-spirit involvement. So that is one area that I think there's a lot of really great work happening that is centering two-spirit experience, or that is working against kind of heteronormative models. But in the broader day-to-day health provision, I really haven't seen. I mean, I have been doing a search and looking for, champions, ways that organizations or models that are being used. And for myself, there isn't really a lot that I have come across, unfortunately. That is the one area that I think, there are certainly organizations doing work, say, with Indigenous youth around sexual health, that is about education, for example. But in terms of direct health provision, no, I haven't seen any, unfortunately.
Okay. So we have time for one more question. I just want to refer to one question from somebody from working in Musqueam in Vancouver, and wants to know, are there any local initiatives for non-Indigenous mental health workers to get involved in for decolonizing mental health services for supporting local Two-Spirit communities?
Mm-hmm. All across North America, I think there are certainly quite a lot of conferences that are held around either Two-Spirit specific conferences. There's a conference coming up on trans health in BC especially. There's a lot of new initiatives that are forming, including Two-Spirit trans people. There's new resources. There's resources for parents. So that is one area where there's a big growth. I think, being connected to different organizations that might hold gatherings or conferences, I think that's one idea, to come in and hear and partake in training. Yeah, that would be what I recommend. I mean, I do often recommend that people really start local. So I think I appreciate the question to think about, what's available here near Musqueam. And there's also actually this year, the Queer Arts Festival in Vancouver is being framed around Two-Spirit, kind of celebrating Two-Spirit arts and culture. So I think that's also, like I mentioned, I think that's also important. We can do the reading and the training and thinking, learning specifically about this in relation to health, but more normalizing, Two-Spirit peoples and bodies and relationships, that I think we can do through lots of creative ways. So come on out to the Two-Spirit Arts Festival. I think that's also a really important way to be amongst the local community and learn and make connections in that way. So
Sarah, I want to again thank you for a very informative presentation. With that, I want to close the webinar and thank everybody who did come out and listen to Dr. Hunt's presentation. And again, thank you very much, Sarah, for a very good presentation. Thank you so much.
Thanks, Roberta. Thanks, everybody. I'm sorry I didn't get to all of your questions. I appreciate everybody for being a part of it. Take care.